Our guest today is a world-renowned cardiologist who was a surgeon at the famed Cleveland Clinic, the top heart hospital in the world. He is the author of the best-selling book, Prevent and Reverse Heart Disease, which I read. He was also prominently featured in the groundbreaking documentary Forks Over Knives, which I saw maybe 16, 17 years ago. His pioneering work with coronary artery disease has saved countless lives. It's been 6 years since I last interviewed him. We have a lot of catching up to do. Welcome back to the Motivation Show, Dr. Caldwell Esselstyn.
Thank you, Eli.
So I have read your book, and you made a very fascinating statement. And you said that as a physician, you are embarrassed by your profession's lack of interest in healthier lifestyles. What do you mean by that, and how should it change?
Well, probably for over 100 years, we've known that there are multiple cultures on the planet Earth where cardiovascular disease is virtually non-existent. Rural China, Central Africa, the Tarahumara Indians in northern Mexico, the Papua Highlands, Okinawa, practically disappeared. Why? Because they thrive on whole food, plant-based nutrition. But the American Heart Association was formed in 1924, all right, 100 years ago. Have we ever brought that information to this country? Has Western civilization, New Zealand, Australia, Europe, the United States, South Africa, have they ever taken that information from those cultures where the disease is non-existent and brought it to their cultures? No, we do not treat the causation of the illness. We use drugs, stents, and bypasses, not one of which has one single solitary thing whatsoever to do with the causation of the illness.
Well, I'm all for getting to the root of things rather than just treating it when it's a little too late. So that's why I wanted to get you back on the show and fill in any dots, cross any T's that we didn't get to the first time. So, most people at your tender age would probably be just kicking it back and, would have been long retired and not doing interviews like this, and but by the way, I'm very grateful for. So why do you continue to talk about eradicating or slowing the progression of heart disease? Why is this such a mission that's still driving you?
Well, it's driving me because so many people who are perishing, they're dying from this disease that really, in truth, is nothing more than a toothless paper tiger that need never, ever exist. And if it does exist, it need never, ever progress. Because sadly, the profession has never really educated the public about the causation of this illness. And if it just seems ridiculous for me to sit by and watch everybody perish from this disease if there's some way that I might be able to help.
So when you speak of preventing and reversing heart disease, are you primarily speaking about coronary artery disease, or are you referring to all heart disease?
No, I mean, obviously, if somebody has something wrong with the valve, or they've got an infective problem, or something related to strictly to hypertension, which will secondarily cause heart disease. Yeah, no, I'm focusing largely on the leading killer, which is the plugging up of the blood vessels to the heart, coronary artery disease, which also, I should say, often those same people will have disease in other arteries, like the carotid arteries to their head, and maybe arteries to their legs, and so forth.
Interesting. So, I've been looking at the internet on YouTube, and it's filled with doctors and others that are actually promoting something that's a little bit opposite of what you're kind of talking about. They're talking about keto diets. My own doctor says, oh, you got to go on a low carb diet. And they swear by their research. How do we explain the so-called claimed successes of those diets?
Well, I think that I'd like to see the research that they're swearing by. I mean, for instance, are they able to show us a reversal of symptoms, a reversal of angina, a reversal of erectile dysfunction? And can they show us reversal of disease on an angiogram, reversal of disease in the carotid? I've never seen that from the various specialties that you just mentioned, either
Also,
low carb or keto. Where are their angiograms of reversal?
in your book, you talk about there's a bonus to following this whole food plant-based diet, and that is it's not just going to help coronary artery disease, but it's going to help a plethora of other things. Like what, for instance? Can you share that?
Strokes, right? Diabetes, hypertension, uh, rheumatoid arthritis, and lupus, and multiple sclerosis, Crohn's disease, ulcerative colitis, allergies, asthma. This is the greatest gift that medicine's had really in the last 100 years, because there's so many other things of chronic illness that really are affected.
So, speaking of Crohn's disease, I have family members that have that. And I think they may have been advised, I'm not sure, but I think that maybe certain vegetables might irritate it. Can you speak to that?
Well, I've not done a lot of research. I look at that from others, but I would just simply say that if there are certain vegetables that are bothering them, then they should avoid them.
I also think you have had some history at the Cleveland Clinic with cancers, right? Breast cancers, right? For instance, tell us about how the diet would affect cancers.
Well, I never did research with the diet and breast cancer, but there's no question. I think that when I was writing the book, or actually we were looking at Forks Over Knives, when you do a global bit of research, there are multiple cultures which have breast cancer rates that are 30 and 40 times less frequent than the United States, for example, in Kenya. Or if they looked at rural Japan in the 1950s, breast cancer was very infrequently identified. Yet as soon as the Japanese women would migrate to the United States, by the second and third generation, they now seem to have the same rate of breast cancer as their Caucasian counterpart.
Well, that's convincing. So, one of your pet peeves is when somebody has coronary artery disease, not to have, as you say, even a drop of oil, not a drop of oil in a cracker or anything else. So why are oils particularly bad for coronary artery disease? And are there any oils that are good for those that actually maybe don't have heart disease? Because I got to tell you, when I tell people that, they fight me and they say, no, olive oil is great. I do olive oil. It's cold press. Your thoughts?
Well, the problem with olive oil, and there are studies that show this clearly too, that when you're when you look at coronary artery disease, it's all experts would agree that where this disease has its inception, its onset, its beginning is when we progressively injure the life jacket and the guardian of our blood vessels, which happens to be that delicate innermost lining called the endothelium. And it is the endothelium that is responsible for making a truly magic molecule of gas called nitric oxide. And it is nitric oxide that is responsible for the salvation, preservation, and protection of our blood vessels because of the remarkable functions that nitric oxide has. However, when you eat oil and a bunch of other foods that we can get to, when you're eating oil, you injure the endothelial cells. And when you injure the endothelial cells, you're now getting deficient in nitric oxide production. So you're losing your protection.
How do we know that oil injures the endothelial cells?
Well, the the inflammation, in other words, if you measure the inflammation when you're eating oil, you can see that for instance, there are 5 biomarkers that will be elevated when you're getting inflammation. And those are things like oxidized LDL, asymmetric dimethylarginine, myeloperoxidase, TMAO, trimethylene, and also HSCRP, highly sensitive C-reactive protein. Those are inflammatory indices. Those are the kinds of things that will go up when you're eating certain foods and oils.
So,
saturated. Also, olive oil has saturated fat, and saturated fat, of course, will push up your LDL cholesterol.
are all saturated fats bad?
Well, let's just say that you don't want to put you don't ever want to push saturated fats. That's fat. That what you're saying is, how much lard and bacon should I be eating every day? The answer to that is 0.
Well, saturated fat comes in other like forms, right? It'll come in like sesame seeds, for instance,
Yeah.
So
Yeah.
is there a difference between the saturated fat from a sesame seed versus the lard?
No, the actual chemistry should be pretty much the same. But for instance, we don't mind if patients will take a couple of tablespoons of flaxseed meal on their cereal,
Chia.
and also chia seeds. But that's about it.
Okay, so those have saturated fat, but those are acceptable saturated fats.
All right.
And don't cheat off that. Gotcha. So tell us about something that's, I guess, relatively new in the cardiology field. Probably wasn't practiced back when you were a young puppy. And that's called the calcium score. Tell us a little bit about that.
Well, calcium score is simply a CT, computer tomography, chest X-ray. And if you've got coronary artery disease and you have plaques in your coronary arteries that are calcified, that'll show up on the X-ray. And as far as, I mean, it's a safe early way. For instance, if somebody, let's say, has got obesity, hypertension, diabetes, they're at risk. And probably by the time they're 35 or 40, they ought to be getting a CT's calcium score, because it's very provocative. Because if somebody at that age sees that they're already starting to fill up their arteries with plaque, it's time that they got serious and got on a plant-based program.
Right. So if somebody has a high calcium score, but then they adhere to a whole food plant-based diet,
But
what do you think?
is to find some place where you will get that. For instance, it's sad to say that very few cardiologists, either in medical school or in their postgraduate training, don't really receive any information on nutrition. And often, if they have as part of their treatment of the patient, they'll say, "I want you to see a dietitian." What makes you think the dietitian has got a skill set in terms of showing somebody how to eat whole food plant-based nutrition? Because you see, the reason, well, I think our most recent paper, 2014, some 200 patients, and it was really rather fascinating that after close to 4 years of follow-up, 89.3%, almost 90%, was still following our program.
That's pretty good adherence. So,
and I think we can even do better.
I like the optimism. I'm all for it. So there are some books out there which challenge some of the conventional cardiological thinking. One is called The Great Cholesterol Myth by Dr. Stephen Sinatra. What really is the truth about cholesterol? Because a lot of people are confused. That seems to be the model that most physicians use. They look at your cholesterol and that to determine if you've got heart disease, you should be alarmed. So how important is it to lower the LDL and raise the HDL, which is the two things that we hear all the time?
Yeah, there are a lot of studies that clearly show that if you can lower your HDL, you're going to be
the LDL, right? Lower the LDL.
Your LDL, you're going to be better off.
Yeah.
On the other hand, even if you lower the LDL, it doesn't. You're not fully protected from disease progression. Let me just say this: if you try to just treat somebody's LDL, but you're not treating the protection of the endothelium, in other words, you're still eating bacon and lard and all those other horrible foods. Even if you're taking a statin drug to lower your LDL, that's not gonna help. I'll correct myself. It may help, but it's not going to wholly. What you're trying to do when you treat these patients is not only stop the disease, but give them an optimal opportunity to reverse it. And then that's when I think I was going to challenge what was the group that you mentioned that, Dr. Sinatra. I've not seen his angiograms of reversal yet. Have you?
I can't say that I have.
Oh, does he have any? Why would anybody who does research in this, when there's such a profound example of disease reversal as reversal on an angiogram, why don't they show that?
Well, it's in your book. I saw some of the reversals of those angiograms. You give some really profound examples.
Yeah.
Gotcha. So what do you think of statins? There's a lot of controversy about that. There's even a book.
Well, there's data that shows that if you're eating the horrible Western diet and you take a statin, you're going to help your disease.
Okay, but if you go on a whole food plant-based diet,
no data that statins, if you take statins, you're going to stop your disease entirely and reverse it. No. We have many patients who, when they come to see us, have long before they came to see us, they've had to stop a statin because they had side effects that were devastating. For instance, severe muscle cramps, injury to the liver. It gave them diabetes, or it gave them brain fog. They couldn't take the statin. They're going to do fine. Follow the program 100%. Eliminate the foods that are going to injure the endothelial production of nitric oxide. Then they suddenly reverse. That is, they start to make nitric oxide again. And then they begin to absolutely halt any progression of their disease. But you can really see this, especially in patients who have a stable angina, all right? And what they find within 2, 4, 6, 8, or 10 days, I'll get a phone call. Dr. Esselstyn, I can't believe what's happening here. My chest pain is not only diminished, but in the last few days, it's gone away when I usually do whatever it takes a little bit of effort. So it's what happens is you got them hooked because they suddenly realize that what they're doing is absolutely beneficial and is stopping their disease. And they're doing it by eating delicious food.
So your prescription pad would be whole food, plant-based diet. You wouldn't be writing out that statin thing if they're adhering to the whole food, plant-based diet.
Yeah, I don't. If patients come to our program, and 99% already have a cardiologist at home, I don't ever try to drive a wedge between the doctor and the patient that we're seeing. So using that approach over the last 40 years, I have yet to receive a single phone call or email from a patient's physician saying, Dr. Esselstyn, how dare you teach my patient the healthiest diet on the planet?
Oh, that's pretty funny. So you make a very clear distinction between a vegan diet and a whole food plant-based diet. I don't think most people know the difference. And I think some people are proud vegans, but are not necessarily whole food plant-based adherents. Tell us about the distinction and the difference.
I will, but you tell me, what does vegans eat?
Well, vegans eat a lot of processed foods because they're trying to substitute and get that hamburger that they can't really eat and not going to eat beef, so they're eating a substitute, and in that substitute there are some very funky ingredients.
Or they eat oil and they eat French fries. I teach
Yeah.
vegans these all the time. Yeah.
Yeah. So let's get into it. Let's get into the nitty gritty. Let's get into the whole food plant-based diet, and let's get into the greens and why that's so important.
First, let's get the basics, and that is we want people to stop any drop of oil. Olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a chip, oil in a piece of bread, oil in a salad dressing. Oil is the killer, all right? Also, we want to have them eliminate anything that's animal protein: meat, fish, chicken, fowl, turkey, and eggs. Also, eliminate dairy, milk, cream, butter, cheese, ice cream, and yogurt. And we'd like to eliminate also sugary drinks, Diet Colas, Pepsi, and Coke. Also sugary foods, cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey. We also eliminate peanuts, peanut butter, nut butters, cashew sauce, and avocado. Now, and also coffee with caffeine. Now, what are you going to eat? All these marvelous whole grains for your cereal, bread, pasta, rolls, and bagels, 101 different types of legumes, lentils, and beans, and all these marvelous red, yellow, and green leafy vegetables, white potatoes, sweet potatoes, and some fruit. Now, the reason I made a modification about a decade ago was out of recognition of the fact that the endothelial production of nitric oxide is age dependent. For example, you never saw a heart attack in a boy or a girl at age 8. Why? No, they have nitric oxide coming out of their ears. However, by the time they're beautifully healthy at age 50, they now have 50% of the nitric oxide they had when they were age 25. And now by the time they're 80, you lost 70%. So now the changes I made were to include a greater stimulation of the endothelial production of nitric oxide. Plus, we embraced the newer research that shows us that mankind has an alternate pathway for making additional nitric oxide. And the way that is done is you have the patients 6 times a day chew a green leafy vegetable approximately the size of one third of a cup after it has first been steamed or boiled 5.5 to 6 minutes, so it's nice and tender. And then you must anoint it with several drops of a delightful balsamic or rice vinegar. Why? Because research has shown us that the acetic acid in those vinegars can restore the nitric oxide synthase enzyme, which is contained within the endothelial cell and responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich, that's 3, mid-afternoon 4, dinner time 5, and of course I adore it when you have that evening snack of arugula or kale. Now the second benefit, when you're chewing the green leafy vegetable, it restores the capacity of your bone marrow to once again make the endothelial progenitor cell, which will replace our senescent, injured, worn out endothelial cells. The third benefit, when you're chewing the green leafy vegetable, you are chewing a green nitrate. As you chew the green nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce the nitrates you've been chewing to nitrites. And when you swallow the nitrites, it is your own gastric acid. which is now going to reduce the nitrites to more nitric oxide, which can enter your nitric oxide pool. So think about it. What you're doing for minimal expense, no side effects, all day long, dawn to dusk, morning to night, you are absolutely restoring nitric oxide, the very molecule, the deficiency of which has given you this disease in the first place. Now, there's a caveat to this. Toothpaste with fluoride, public drinking water with fluoride, and mouthwash will injure the beneficial bacteria in your mouth. Excuse me, now. And also, I think it's important not to have any antacids, because antacids will decrease your gastric acid, and you will be unable to reduce the nitrites to more nitric oxide. Now, the top 6 vegetables are kale, Swiss chard, spinach, arugula, beet greens, and beets. If you want the whole group, it goes like this: bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard green, turnip green, nappy cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, arugula, and asparagus. And the reason I go through it like that for you is you have to know how important whole food plant-based nutrition is for your memory.
Well, you've just made it actually kind of exciting, because a lot of people would be like, well, I spoke to a friend of mine and she's like, I want to listen to your interview with Dr. Esselstyn, but, I don't think I can give up, certain parts of the diet.
That's just so silly. If somebody has got heart disease, do you think they say, well, I understand how I produce this disease, but God, I love my bacon, and I think I'll continue to see if I can't destroy some more of my endothelial cells.
You put it that way.
But anybody, when they've got a brain in their head, sit down to a meal of foods that have been clearly identified as those that are going to destroy you. I mean, you don't necessarily have to have a heart attack. You can have a stroke.
Yeah.
You don't always have a choice.
Let's talk to the people that have that sweet tooth and that salty tooth. Is there any substitutes for sweetness and for salty things? There's like a salt substitute, a sugar substitute. You said even stevia is no good, right?
I think what you do, you learn to accommodate without salt. That's something that everybody, I think, can handle. I mean, it may be tough at first. It's a little flat.
Lemon, lime.
And then things like lemon, lime, vinegar. Okay.
How do you feel about taking some bananas, putting it in a blender, throwing some cinnamon and vanilla, and making yourself a nice like banana ice cream or shake? That's perfectly fine.
Or you can use it in a what is it called? Unami? Unana
machine.
A Unana machine, yeah. That'll give you a nice ice cream out of a banana.
There you go. There's plenty of stuff, right? How about some people say don't eat nightshades? Is that a factor in your mind?
Nope. No, nightshades really, I think, can be very healthy.
In your opinion, what's the next best foods after greens?
Well, I think the next thing would probably be the best thing would be more greens.
So,
well, I think legumes are pretty wonderful.
What if somebody wanted to, instead of 1/3 of a cup, wanted to do 2/3 of a cup 6 times a day? Is that better?
I'm not aware that that's any better.
Okay.
It might be, but I think that it would be a little bit overwhelming. I mean, right now we're at for some people that's hard to remember, but I think what makes it easier, I think the reason that we get that adherence close to 90%. I just drill it and drill it and drill it and drill it into them. They have to know the relationship between the endothelial cell and its ability to manufacture nitric oxide, because then it makes it so much easier for them to comply to this kind of approach, which is a little bit strict. But when you think about it, really the strictest diet on the planet is the one that really guarantees you're going to have heart disease. And it's so there are so many books out now that people can learn how to safely eat and deliciously eat whole food, plant-based nutrition.
So if somebody came to you and their prognosis was quadruple bypass, would you put them on this diet? And
let me give you an example.
Yeah, tell us about how that would work.
If they're stable, I'll give you an example. The oldest patient that I ever had come to me and want to be treated was 87 years old. He was from California, and he'd been told at 87 he had to have quadruple bypass. He was convinced that if they sawed him in half, he'd die, that he wouldn't be able to tolerate the operation. And at that age, the mortality of a bypass is a lot higher than it is if you have it when you're younger. So he came, and he really came on board 100%. And every year he'd give us a call, let us know how he was doing. 2 years ago, I got a phone call from him. He was asking to speak with my wife. He wanted to talk to Ann because he wanted Ann to give her a number of, about 50 new recipes. And so after she gave him the recipes, she said, well, what's the occasion? He said, well, I'm celebrating my 100th birthday. So that was 2 years ago, right? Last year when he called, he said he called because he wanted to be sure to remind us that he was now 101.
Wow.
This year when we got his call, he was saying he was calling to remind us that he was now 102.
That's good success. I like that story. We need more of those. I hate to play devil's advocate, but probably some of the people that are watching and listening to this are going to say to themselves, well, what if somehow I do all this and it still doesn't, improve and reverse? Is there a point where you give up and say, go ahead and get your angiogram, have them do some angioplasty or stents or get your bypass? How does that play out?
Well, we haven't seen it. Yes, I would say that in my 40-year experience with this, there's been one patient actually from Canada who I never have met him, but he swears that he was following the program absolutely 100%, and he just had disease persist. But by and large, when the plaque is made up of inflammation, fat and cholesterol, and the plaque is young, it is very vulnerable to being reversed when people follow the program 100%. Now, there will be older patients who have a plaque that is a decade old or longer, and it's made up of fibrosis and scar and calcification. It's not going to rupture, and it's not going to cause a heart attack, but it's going to be more stubborn. The interesting thing is, even those patients seem to do well and be able to get back to regular daily living. So I don't think I can think of any kind of an excuse why it would be good to stop the benefits of the plant-based nutrition from what we've seen so far. And that's why we've tried to have people understand that this is not hype or snake oil, but that's why we try to justify them finding this published in peer-reviewed scientific articles.
Well, I like the odds. I like your odds better than taking the odds of having a chest cracked open or something like that. In your book, Prevent and Reverse Heart Disease, there's a fascinating quote by Dr. Lewis Culler, I believe is the pronunciation, from the University of Pittsburgh. And he says, all males over 65 years of age, and you added all females over 70, exposed to a traditional Western lifestyle, have cardiovascular disease and should be treated as such. That's a stunning statement.
That was based on the basis, he uttered that on the basis of his 10-year cardiovascular health study. He made that statement first when I was moderating a panel in the West Coast, and he was on the panel, and he made that statement, and I made him repeat it when I was writing the book, so I'd get it correct.
So one last question on food. Are olives okay? Because it's that way.
Let me come back one more minute.
Go back to that.
Blue color.
Yeah.
To back that up, there was the first time we really got insight into the early onset of this disease in the Korean conflict, when we autopsied our GIs at an average age of 20, 80% already had gross evidence of coronary artery disease that you could see without a microscope. Not enough for their cardiac event yet, but there they were at that young age already starting to develop the disease. That same study was repeated 45 years later in 1999, this time looking at young women and men between the ages of 17 and 34 who had died from accidents, homicides, and suicides. And at autopsy, the disease in this group was now ubiquitous.
Oh, my God.
Everybody. In other words, not enough for their cardiac event yet. But so when I have somebody, let's say that's a husband had a heart attack and he's age 65 and his wife is now 64, she doesn't like the idea of eating this way, although she's willing to have her husband eat this way. And so I mentioned to her, I said, well, what makes you think you don't have heart disease? Oh, she said, I'm fine. I don't have any symptoms. No. So then I started quoting to her the autopsy studies. And she's not, I said, are you over? She's 64. I said, are you over 17? Then we know you're loaded with some vascular disease.
Oh, my God. So in ending the program, how do people continue to learn from you? I understand you have seminars, of which I'm going to be taking one this month. That's, I believe, was it 5 hours? Tell us about that.
Well, if you're going to have patients make a lifestyle change, which is profound, you've got to show a patient respect. The only way that I have to show a patient respect is to give them our time. So we've set up 2 parts to this seminar. So the usual cardiovascular patient sees a cardiologist for 10 or 15 minutes. And if you think that they're going to make this kind of lifestyle change, you've been dreaming. So
not a chance.
So we try to have 2 things happen. One, we have a 5-hour seminar, and secondly, we have more or less what I'm doing with you now. I am a little old-fashioned, and I insist on personally myself calling each of those patients a week or 2 before the seminar so that I can get my arms around their story, and at the same time have them ask questions of me so that coming to the seminar, we have a strong platform from which we can all move forward. At the seminar, I get about 3 hours to kind of go over the science. Then Anne has an opportunity for an hour and a half to discuss foods. My son-in-law, Brian, has a wonderful presentation of about 30 minutes on food architecture. And then we also have a marvelous patient who's been with us now for over 15 years, who reversed his disease. And then we have a sort of a chat room. And then suddenly that's 5 hours.
Well, for those that are watching and listening to this show, I have to tell you, follow in my footsteps and do it before it's too late. Dr. Esselstyn's program is like nothing else. I've done a lot of research. I've interviewed a lot of people. Email me at motivate@gmail.com, motivate, the number 2, the letter Z @gmail.com if you have any further questions. And to register for your program, Dr. Esselstyn, they can go to your website.
Yeah. And talk with my secretary.
And talk to your secretary. All right. Anything else in your future? Anything else you want to add before we close?
Yeah, hold on a moment. Go ahead.
They need to talk to Jackie to reach that she'll connect them with you.
Oh yeah. No question. When you get my secretary, she knows how to orchestrate and really register the patients for the seminar. Yeah.
And her name is Jackie?
That's right.
All right. Speak to Jackie, get yourself registered, and live a long, healthy life. And you're doing pretty good as a young spring chicken there, Dr. Esselstyn. So you walk the talk. God bless you. Thank you for coming on the show today.
Eli, thank you. All the best.